It's easy to use, almost anyone can use it, and it improves the chance of survival by restoring the victim's heart pattern. AEDs are readily available in many places now: shopping centers, schools, daycares, recreation centers, grocery stores, airports, and many more. It's effective for 6 to 7 out of 10 victims. Your victim you may encounter may be your loved one, and your quick response could make a big difference in their survival. Today we'll cover the steps of how to use an AED and apply it, to become familiar with how it works, and as we will see, it's got audio commands and pictures to guide you through the steps. Witness cardiac arrest or a victim that is found unresponsive, there's 3 things that need to be done very quickly. Number 1, call 911, get you some help on the way. Number 2, retrieve the AED. And number 3, check for breathing and pulse. To assess for the need for an AED, we'll check for breathing and circulation. Need to place the victim on their back if they're not already. You will open the victim's airway, and you'll look, listen, and feel. You're looking for any chest movement with breathing. You're listening for any breath sounds, and also if you feel any breath on your cheek. If the victim is not breathing, you need to immediately give 2 rescue breaths as you would in CPR. Next, you would check for a pulse. This is done on the carotid artery on the victim's neck. You'll check to see if you feel a pulse. Checking for breathing and pulse, do this for no longer than 10 seconds. Once it has been established that the victim does not have a pulse, this is an indication we need to use the AED. We need to apply the AED using the proper steps. You get your pads out. It's got detailed instructions inside. We'll turn the machine on.
Connect electrodes.
Connect electrodes. These are your pads, and it's got a picture on the machine of where to plug it in at. Plugged in. Next, we'll apply the pads to the victim. We want to put one pad on the upper right of the chest. It's got pictures on the pads if you forget where they're supposed to go. One on the lower left, again, you have a picture there. You want to make sure before you apply the pads that the victim's chest is dry. Wipe off any sweat or water that may be there. Electricity and water do not mix. There are child-sized pads that some AEDs come with, which is great. If you don't have any child-sized pads, you can use adult pads on children. Do not use child pads on adults. They will not be effective. For infants 1 year or less, the AED is not recommended. Now that we have our pads in place, we're ready for the machine to analyze for heart rhythm. We'll mash the analyze button and wait for it to complete. You want to make sure nobody's touching the victim. Any movement can cause the machine to pick up a heart rhythm that's not there. It's giving us the shock advised message. It is charging up. Stand clear. Make sure nobody's touching the victim or they can be shocked as well. And the pads delivered a shock. Now it's advising us to analyze again to see what the heart rhythm is after the shock. If it would have given us a no shock advised message, it would have instructed us to check for a pulse and give us a few seconds for that and advise us to start CPR. It would give us 60 full seconds to provide CPR, and it would ask you to stand clear and analyze again. Every step that this machine tells you to do, you need to follow until number 1, the victim becomes responsive, or number 2, emergency medical personnel arrive to take over care. You should not remove the pads. If you do revive the victim and they go back into cardiac arrest, it can be used again. Cardiac arrest with external defibrillation very quickly greatly increases the chances of the victim's survival. This is something the AED can do outside of a hospital setting. We've covered the steps of what to do when we find an unresponsive victim. We quickly call 911, retrieve the AED, check for breathing and pulse, apply your pads, and then of course follow the commands of the AED. During the time it took me to give this speech, 21 people went into sudden cardiac arrest, and 7 of those will not survive.